we are at, I don't think we are coming at a, we expect the companies to go to the next level
Yeah.
saying that we are saying lights out plant or something like that. That is far away. We are just in the second or third level, fifth level if you consider this. So now most of the people have started putting instruments onto the manufacturing, which was also not there. So instrument digitalization has happened now on the manufacturing. So we are second level. Now next is the AI basically. The decision related to the batch can be made by the machine instead of technique. But that's the next level probably. And then lastly with the lights out. So lighthouse plants have now started. Like if you see at Sipla or the Dr. Reddy's, they got their one plant at least into the lights. No, lighthouse plants. So where we can look at
Yeah.
it. But next step is lights out plan. I mean, nobody is required. We can operate from our home. Everybody. That's a far away.
Shirish, that according to you, over the last 5 years, 10 years, as you have observed the industry, how has the perspective shifted in terms of just the emphasis and belief in what the technology can do for the pharmaceutical manufacturing business?
Correct. I think I am in last 46 years almost in the pharma field, and whole of my career is devoted to the pharma technical things, manufacturing, quality assurance, R&D, formulations, and sometimes I wonder from what stage we were and what stage we are today. Once when we were earlier our batch records, if you see in the earlier 70s, 80s, just 4-page batch record, and then you have to actually tick mark the things and put some figures and other things. That was the very small batch. From there, we have come to batch records. Now today, I don't know, 80 to 150-page batch record for each batch. Going into the details. So I think that is batch record we are talking about. But technology also changed. Though one thing we must see, still the technology of making the tablets is the same. There are a lot of changes related to the accuracy and bringing, but basic equipment have not changed. If you really see pharma, and that's what my we are not changed like other people have gone into the different technologies. Our technology of manufacturing remains same. Tablets are still tablets how it was made earlier. There are some changes are happening now which can change probably. Now we are talking about some of the they call it as a what printing. Uh, you can
Yeah.
print the tablet probably. That is the another thing which, but still it is long way. It is yet to take these things the next level. So my grouse was that really the pharma, though there are scale had changed, the quality of regulatory had changed, quality had changed, basic structure has remained the same. That's we still make the tablets the way in which we were making tablets earlier. Mechanical automations have happened, but the basic tablets technology has remained the same. That's what I believe. In the injectable field, probably fill finish manufacturing and filling the injectables has remained same, but the all other things related to this, the validation systems and other things have changed dramatically. Another thing which I see is that another change which has happened basically is related to the type of the recording what we are doing for every, it could be SAP, it could be our own manufacturing. So there the efficiencies have built it up. The scales have gone to the 10 time 15 time what we used to do earlier. Documentation has reached to the next level, which I was talking about, 80 to 150-page batch record. And now we are looking at again coming back to the electronic BMR and other thing, which will reduce the amount of the work, yeah, which will reduce the amount of work of writing those things. Many of the things will be caught by the computer using the uh, recording systems, biometric recording systems, as well as doing things very differently from the basic, though it is remained same. These things have changed. How we are entering into the system and other things. I wonder if I remember those days when we were preparing. Today, that will not be allowed to manufacture that product that way. Using the recoveries. So many things have changed over. Now we look at the each batch very separately from each other. Yeah. So it is sometimes I remember when I want to talk about it, I go into the different speed actually. It's a different world and different era probably. None of the things what we are doing today
Yeah,
probably, yeah, that's the change, big change.
it probably brings quite a few memories as well. So I think straight away you have brought in a really interesting perspective that we have shifted from somewhere like 5 pages of batch records to perhaps 50 pages or even 100 pages of
150
batch
pages
record.
is the standard currently.
Right. Yeah.
And it is impossible today. We expect the quality assurance to release the batches based on the document checking and whatever review of the document. Is it possible for a single person, quality assurance persons, to go through the complete entire batch record and come out with either released or unreleased or the quarantine? Well, it's a humanly impossible to do this currently. Batch records have gone up. We expect the batch five batch records to be reviewed in a day and release batch, which is impossible task actually. So with the new technologies, probably it is becoming easier. What we are saying, because in EVMR, for example, you only get the deviation sheet. You don't have to worry what has happened all the other time. They will be on the line. Any deviations will get caught onto the record, and unless you put the remarks or whatever you have to do that deviation, it will not be allowed to move further. So that's an advantage now. But you have gone from
Yeah.
different difficult things actually for them. Yeah. I,
Yeah, so just to put this into a summary, it seems that we have rightfully placed a lot of focus on doing things in the right manner, recording critical manufacturing process and materials and quality data, and making sure that the process is followed as much as possible.
yes.
And all of these things make complete sense to me because we would like to manufacture high quality drugs. Ultimately, it has a huge impact not only on the patient outcome, but at the same time, pharma companies' financials depend a lot on the success of and the speed of manufacturing of the drug batches. So I think rightfully there has been an increased level of focus on getting the compliance and quality right, but that has probably increased the manual effort, or in other terms, the additional work which compliance brings. And according to you, that's where we can go back to good old days where we have to review only 5 pages. But this time, this information is not for the entire batch record, just deviations, any critical things that we need
Changes.
to look at, highlighted items, stuff like that. So I think really, really interesting perspective that you have brought in, Shirish. So uh, just would like to go one level deeper here. So Shirish, in addition to the manual effort which goes into reviewing uh,
Imagine.
the hundreds of pages of batch record, and you said perhaps even 5 to 10 times in a day, depending on the scale of your operations. In addition to the manual effort, what other things can it impact for a pharma manufacturing company?
One thing is important here is that we are seeing that data integrity is becoming an issue for last six, I think 10, 12 years probably 2011 onwards. Many companies have faced these problems of the data integrity. Somebody manipulates the things and puts it to the. It is possible with the manual efforts what we are trying to do. But in EABMR, what happens is that you are able to what we call an ALCO or contemporaneous recording of everything. That will happen only with the unless you have got electronic systems and what can get caught up every activity which is being done in the pharma. So there it helps in the big way. I hope I'm making the point which is your.
Yeah.
So if your systems are right and if then you will know about the batch exactly what was performed contemporaneously without any problem. Accurately recording also legible in the alcohol principle. If you really look at it, alcohol meet it can be meet totally with the electronic systems, not just by manual systems. Because earlier, if you
Yeah,
remember, somebody is doing the batch record, or sorry, if somebody is performing the line clearance at the end of the packaging, you can just tick mark by sitting into the one room and doing it. But when you have to go to record, actually you have to go to the equipment, get it clarified, and then cleared. Then only line clearance will be complete. So sense of getting it done properly has come into the picture because everything is getting recorded now. Most of our equipment, except some equipment, you are able to download the data directly from the equipment itself and not by just recording something. So it has brought the data integrity gone to the next level now, probably. And
yeah.
if you
And I
see,
think which
remember,
brings me back to another point that not only are you reviewing the executed batch record, but you are also reviewing the raw data which comes out of the
yeah,
machine via its audit logs. And I think that adds to the entire
yeah,
work stream as well.
correct. There are very few equipment from which you can't get the data. Most of the equipment which are all electronic and we can control it. All alarms are settings. We can check every alarm. If any duplication of the activity is done, you are able to see from the audit trail of the equipment, like what we do in the quality control now. In manufacturing, also, this has happened now, that change has come, which gives the biggest assurance to the regulators that the things are in the right spirit.
Yeah. And Shirish, it seems that there are good amount of improvements that can be brought in by leveraging some of the technologies that we would
Absolutely.
go deeper into later during this chat.
Correct.
Uh, and basic amount of technology has existed, for the last decade or so,
Correct.
or perhaps even more. According to you, what has been the uh, most critical blocker in adopting these technologies for streamlining or accelerating the pharmaceutical manufacturing operations?
I think earlier we used to say the regulatory could be an issue over there. And that was one of the things which we were not ready to put the things into the system because of regulatory issues. And again, we have to repeat the validation or something like that. But I think FDA is now very clear that they are actually encouraging those things. Means with the new technologies also, as well as the what if you are going with the electronic batch record. This is accepted norm now with the FD. Earlier, we used to have a lot of questions on those things. Last 11 years, 10, 15 years, I think, now people have started putting all digital controls onto the system. It is not still full blown, but at least big companies have gone to that level. Means at least first 10 companies, 10 to 15 companies in India have adopted and gone to the EVMRs.
Yeah. Um, so I think that's really
I think
encouraging to hear. Yeah.
two things really help to into this. One is regulatory pressures. You are seeing many
Yeah.
companies, even today in some companies, are going through the data integrity issues. Torn papers, which are lying, even though that may be drafts or something, but FDA doesn't understand it. They see any paper which is thrown out. If there are data, then they will question them. In the latest system, you don't have to do this because you want to become paperless. That's one thing. So whatever is there is actually into the system. Similarly, you are also able to control the inventories, management of the inventories. Of it all can be done electronically now.
Yeah. So, Shirish, you bring up a really critical point that FDA is not only encouraging, but there seems to be some regulatory pressure as well.
Yeah,
Can you delve one step more into that? For for the knowledge of our viewers, um, how is this regulatory pressure perceived as of today?
I think regulatory pressure. When I said this is regarding, if you see really the FD 483 which were given earlier, manufacturing sites,
Yeah,
there were issues related to the audit trails, sample getting checked till it passes. All these things have now come onto the open. So you are able to find it out what has gone wrong at that stage and correct accordingly. When suppose I am doing the twice, second analysis, third analysis, you are supposed to give the reason for it. Even the resampling is now question. You can't do the resampling without you have got the adequate reason to believe that first sample was compromised. So all those things have gone to the. I think two three things which helped really is the one is the why we went to electronic or one thing is this data integrity. Second is during COVID period, those 2.5 years, it was a very big task for the manufacturing particularly because people were not available, operators also were not available for everything, and many things you have to do it manually. That bring the pressure onto the our managements also, that you have to go now more into the electronic systems so that you can be done faster, number of people required will be also less, and the system will drive the whole thing instead of manual thinking and driving the things. And really those people who were not ready to do earlier electronic data processing and other thing have moved to the electronic process. Money was available for this from the companies. Earlier management used to say why there is a need to do all these things. We have got adequate enough people there. They are not able to give even the so lot of things related to the manpower and availability of them, right kind of talent was a question mark. Still
Yeah.
today, even
And
today, we are
Shirish,
not there. Yeah, yeah. Please go ahead.
yeah. So, I keep on watching your sessions with some of the leaders in the pharmaceutical space as part of IPA.
Right.
So, often we get to hear from, right from CEOs to head of manufacturing to head of
Correct. Correct.
quality
Correct. Correct.
to head of digitalization within, all the top pharma companies which are part of the IPA.
Right.
And
Yeah.
everybody has a unified opinion that digitalization uh, and AI will help in improving all kinds of metrics. So when we try to analyze any pharmaceutical operation, it's like any other company with uh, lots of complexities around regulation. So we would like to maximize revenue, we would like to reduce cost, which means that we would like to improve our gross margin or profitability. We would some of the companies are doing now really good in terms of sustainability index as
Yeah.
well.
Correct.
I think this is something which has started picking up, and compliance remains one of the core pillars around which all of this you can say fortune revolves. So there seems to be an alignment in terms of the larger goals that pharma industry would like to achieve using digitalization and technology.
Correct.
And I have had an the fortune of interacting with many leaders as part of my role. This is
Yeah.
an advantage which I have, that I get to speak with so many visionary inspirational leaders who have built pharma companies from scratch, who have
Yeah.
scaled uh, pharma companies to massive heights, sometimes even first generation companies, not just second generation or third generation companies.
We can look at the
uh,
Sun Pharma
and
from where to where. Yeah.
right. And there are many examples, and I'm
Yeah.
sure that you have lots of inside information as well. um, um, but while there is a top level alignment, when you go deeper into why the adoption is still on the lower end, there are some factors which consistently come out.
Mhm.
We didn't talk about cost. I think that's a topic which we'll probably cover or not cover depending on the how this conversation goes. But one topic which has consistently come up during at least my conversations with the manufacturing leaders is that sometimes they are not ready to leverage the BMR or MES platforms, because like you rightly said, equipments were procured 20, 30 years ago, because the technology of manufacturing tablets or technology of manufacturing capsules, injections, it has evolved but it has not been disrupted.
Yeah,
uh,
yeah,
there are incremental improvements. The technology has not shifted completely to, let's say, a 3D printing
yeah. Which
based
I agree. Yeah,
manufacturing technology, or even continuous manufacturing, which will has been picking steam for the last 5 years. But there is still, I think, a few good years to go on that. So given that technology has not shifted dramatically, there still seems to be lots of legacy equipment, and then lack of connectivity to those equipment. How do you get data into a system where you can make use of it? And then ultimately, how do you flow this data from machine to the batch record automatically, so that you don't need to record the critical process parameters? And then, because the data is flowing automatically now, you don't need to review it as much unless there's a deviation. So while the core technology seems to be in place, uh, because of not having proper connectivity with the machines, the equipments, it seems to have become a bottleneck. So what's your take on this challenge? Do you feel that this challenge has limited the pharma company's ability to leverage the latest technologies to improve all the core metrics that we just discussed?
yeah. I think you mentioned the continuous manufacturing, and that's a very important. Everybody talks about the continuous manufacturing. Now, how many people are adapting those continuous manufacturing is the question even today. Because
Yeah.
most of the people even today have done certain parts of their into the continuous manufacturing. Still, we are not in the process that from the API to the or from the starting material of the API to the finished tablet, finished goods to the system. Because there are a lot of things. I think before a few years back, before even continuous manufacturing, people were talking about the PAT tools.
Yeah. 1992, I
Correct.
think, or
It was started at
2002,
that time.
long
But
time ago.
even today, that's the
Yeah.
bottleneck today. Because everything you are not able to do it today because of various reasons. Something is filed, so you don't want to go into this again, refiling and stopping the whole thing. Similarly, the cost of the continuous manufacturing has gone considerably up. Means today, if you want to set up the normal facility versus the continuous manufacturing facility, it is almost 10 times considering the capex. It may give the over the period, it will give the advantage. And people feel that continuous manufacturing is good only for if you have got a big volume. While if you go through the FDA presentation and other things, they talk one is a big volume, but also it can be used for the personalized medicine. So now there is a dilemma. But you talk to anybody, they will talk. It is good for the big product. If metformin is there, do it. We'll have a lot of requirement is in the tonnage, so tons. So people have gone for this in the short scale. But still, the continuous manufacturing has not picked up the way it should have picked it up in India. I think even in Europe or US, certain companies like the Pfizer or Eli Lilly and some other they are there into the continuous. Not everybody even today. And when you talk to the people, they say
Yeah.
these are the issues. One is the cost, one is whether the same product you want to do the continuous management. Today you are doing the normal manufacturing and file it and again get the permission from the FDA for the. Though it is possible, if you talk to the FDA says they are allowing these two ANDAs differently. One is with the normal method and one is with the continuous manufacturing. And I think in India particularly, we have got multi-product facilities. Most of our facilities are the multi-purpose compared to the Pfizer's in the world, who have got a single product facility like atorvastatin. They have got a separate facility where they can do it. Being a multi-purpose, we are still not clear how it will go over the period. And there were a lot of issues because earlier our equipment were not prepared for the continuous manufacturing or the even pack tools. Now people have got understanding that PAT is going to help us, and that we have started seeing that change, at least on the different lines. Many people have put the NIRs or Raman spectrophotometer on the filling lines. Also, people are talking about the cameras which can check the active ingredients into the system. Special cameras. These are available now, but still the implementation is restricted to the big big companies even today. That's what I feel.
Yeah,
But it will change slowly. I think
yeah.
advantage in the doing also, we must see the cost advantage. Otherwise, people will not go for the continuous manufacturing.
Which was actually going to be my next topic, that compliance can be a big driver, but are there other drivers? Does it truly help in increasing the revenue for a pharma company or increasing the profitability? And you did briefly talk about the inventory management. uh, we all know that uh, during COVID there were severe shortages
Yeah,
of material. So suddenly, I think the industry went from
yeah,
the desire to do things just in time to having a little bit of a buffer so that you don't run out on critical
correct,
supplies. But over the last 6 months, again, I think things are getting back to normal, where the companies would again like to reduce their inventory holdups, um, because material is dollars. You don't want have them sitting around in your facility.
correct, correct.
So, are there additional considerations that uh, the companies should consider, in your opinion, to think about bringing digitalization into their facilities?
I think overall, if you look at the lean manufacturing or the, we call it the Kaizen way of manufacturing, what we are doing, I think many things which are related to this thing can be done electronically better. Like the OEs, now we are carrying out the OEs through the normal calculations. In if you have electricity, you can get the all the things together through the system. What is your OE and what really has impacted onto the OE, which is possible to do through electronic means than the manual means. And actions can be taken much faster when you know that things are which point is you are able to realize that which point is creating the problems. So electronics also is helping that way. So it is bringing out if your OEs are better, your productivity and everything will go up. But the way in which you are using the assets. So improvement in the asset utilization will help will be possible if you use the electronic system better. That's what I feel. That's
Yeah, yeah. And we did briefly discuss around the interest which FDA has placed in this entire initiative. In the last, I think, 6 months or so, we have seen several guidelines coming up, very, very specific to AI. So there are not guidelines, but rather draft guidelines or concept papers which FDA has published in evaluating AI as a technology before you implement it in your manufacturing environment. Uh, However, the progress seems to be slow.
yeah. And we are at.
I
I don't
think
think we are
the
coming at
kind of
the. We expect the companies to go to the next level, saying that we are saying lights out plant or something like that. That is far away. We are just in the second or third level, fifth level if you consider this. So now most of the people have started putting instruments onto the manufacturing, which was also not there. So instrument digitalization has happened now on the manufacturing. So we are second level. Now next is the AI basically. The decision related to the batch can be made by the machine instead of taking it to the by the manpower. But that's the next level probably. And then last week with the lights out. So lighthouse plants have now started. I mean, like if you see at Sipla or the Dr. Reddy's, they got their one plant at least into the lights. No, lighthouse plants. So where we can look at it in the. But next step is lights out plant. I mean, nobody is required. We can operate from our home probably though. That's a far away. I think so.
Yeah, no, I think the future seems exciting. I want to take one step back, and I think the issue around not having proper infrastructure in place or the right kind of data connectivity in place. We, you know, you and I were chatting earlier today as well, and we have seen many examples from some of the pharma manufacturing facilities that we know that the technology does exist today. You can get data from a machine without actually having to create a physical connection via the SCADA systems or
Yeah,
getting something from PLC directly. There are really simple technologies available today which can get the data from machine in a non-intrusive manner and really cost effective as well.
yeah,
uh, you know multiple methods there. We probably can't go deeper into that today. Maybe that's for another session, but AI plays a very big role in achieving that, which was earlier somewhat less possible if we go back just 5 years ago. So the technology does exist today where access to data is no longer a problem.
yeah,
uh, Once we have the data, the core digitalization layer which many companies have already put in place, it can enable them to start exercising capabilities such as automated review of batch records, even review the deviations automatically and then highlight just the
yeah,
anomalies. We
correct.
know that there are inline instrumentations that the companies can rely upon for not only reviewing automatically but going as far as releasing the batch nearly automatically with as minimal intervention as
Correct,
possible.
correct.
Uh, do you feel that the question is now just about creating uh, you know a, a good enough, a significant enough uh, value driver within the companies, which is uh, not just compliance but having a true significant impact on the top line as well as the bottom line of the company? So just walk us through how should a leader approach this decision.
Okay. So I can talk about company where I have worked earlier, and we have, like as I was saying, metformin was a big product, and it was always in short supply. Means there are so many companies that are manufacturing metformin. Any company was, they will say we have metformin in the US market. So we used to do a normal way our production, like earlier. You have got the equipments for making multiple product, so you plan it out and do it. So we were thinking that this product is a big, we cannot do it on the multi-purpose line because it takes time, and release time was, I mean, what you call as a, from dispensing till the batch is out from the facility, used to be 30 to 35 days. I mean, I'm just making mentioning the. Then we said this is not in product like metformin. There are no margins left actually. Means this is a basket. One of the product in the basket you should have so that you can go to the distributors and you can get other products also in the system. So we said we need to create a separate facility for that. And I'm just mentioning because this is a dilemma sometimes. And we created the facility for metformin completely separately. We have got the same equipment what they were earlier in the tablet, and we were thinking let us go for the, we must produce at least 14 crore tablet from one single hall from, and there we went into the completely different than the normal. This is the only block which is got starting from the dispensing till the finished product out, including packaging, is on the one hall itself. And quality control, part of the quality control which does this testing is the part of this whole, we call it, or in Kaizen we say that single flow or push and pull system. So whatever is required only
Yep.
goes. And we put this system earlier. We are thinking of going into the vertical so that from the top material will come and down packaging and everything. We kept it on the same floor, U shape. So one side is the dispensing, granulation, blending, compression, and other side is the U shape package, coating and packing. So our cycle time means, and this is all done with the help of the some of the instrumentation. Also, transfer is all through the pipeline, so you don't see the product at all. So it moves to the completely closed system. The earlier our cycle time was something like 35 days to release the batch. With this concept, what we have done onto the metformin block, it gave us the cycle time of 5 days, including release. Our throughput, which was supposed to come from the system, has got almost three times than what it was. The cost of manufacturing, my other products which we were doing in the other facilities, were something like 14 to 16 cents per thousand that time. Conversion only, I'm talking nothing else, which came to the 7 cents for that particular. So we could become competitive because everything was connected through systems. Things have improved a big way. And that was a lesson for us. So we put the system now. The majority of the new facilities are coming. They're put in such a way so that you get the output within less inventory. So one batch at a time will do the granulation. Next it will go to the compression. Next, so once one shift is concept. So pull for the one batch helped us to get the things done. Otherwise, you keep on inventory for 30 days. Any batch goes wrong, that will be kept in the side, and next batch is sorted. So that batch, we don't know when it will come. In this process, U-shaped and single batch moving forward. If a single batch gets stuck for any reason, everybody is on his toes to ensure that it corrected fast. It doesn't go under the carpet. That's the one of the thing which we saw that it is happening. So it is basically all the concepts of the Kaizen what we talk about is really reducing the waste at all the stage.
Yeah.
Yeah,
So by applying, I think some uh, some basic technologies even
yeah, absolutely.
we
Basically,
can bring the
dramatic change into the
batch
system.
release time from
Right, right.
35 days to 5 days, and the cost
Gone down
can be reduced dramatically
almost.
as well, which can bring some comfort in relieving the pricing pressure that we know the industry is facing severely today, and then presents an opportunity to become competitive in
Yeah,
the
in the
market.
market.
And I mean, there are some products which are quite uh, high demand. They are for chronic diseases. Everybody needs them. Every retailer would like to have multiple partners, multiple suppliers
Correct.
to procure from, and having cost competitiveness in one of those drug categories can open up the doors not only for you know uh, monetizing some of these legacy molecules, but at the same time leverage that relationship to expand more. So I think the this brings a lot of perspective to this entire conversation, that uh, by implementing digitalization, we are not only reducing the manual efforts which the quality assurance teams or the manufacturing teams have to make, but ultimately it has a significant and sustainable impact in terms of the way the business model works, the way pharma companies can position themselves against, uh, in comparison with the highly sometimes overcrowded even market. We know that this is only going to become worse, specifically in some of the categories like oncology and some of the areas as well.
Sure. I think you talk about oncology. Oncology is very important because these are the small volumes. They may not be very big batches. So you containment
Yeah,
has to be done, compliance has to be done, all the things. So it's very important there. So whatever you can do it in that area, it will help. Even the biologicals probably. We are talking about the MABs now. The continuous. I was pleased to see that one of the company in India is doing the continuous manufacturing in biotechnology product. So they have
yeah,
continue. Others are talking, but nobody's doing that. So these people are doing this, and good outputs. 21 day cycle, getting almost high, very high yield, and it's compared to their earlier system with continuous money. They are saying that their costs are reduced to almost 50%. And that too in India. I'm
yeah.
talking about
No,
Indian company.
our team has had the good fortune of visiting that facility and
I'm
just
good.
learning from
Good, good.
the operations as well. Yeah.
Yeah, I don't want to name this, but
So I
you know,
yeah.
yeah,
Yeah, so we'll just try to focus on the last couple of things. I think you have been very generous with your time today.
yeah.
Um, so Shirish, to we'll just deviate from this entire conversation. Uh, I think the audience would also love to know a little bit about you know about you uh, in personal capacity. How do you you have been such an incredible leader for such a long period of time, and have contributed immensely to the growth of the pharma industry, specifically via IPA as well. uh, you know h- but what do you do for as personal hobbies? How do you stay engaged? How do you stay interested? So what's your secret of staying
Yeah.
always such high energy and keeping things interesting?
Okay. I think you're talking high energy because energy is required to remain in the pharma. Without that, you can't remain. Actually. But my
Yeah,
interests were in manifold. Basically, reading is my another hobby, and I pick up even the all type of books, political books, then what you call those biographies particularly, and also non sorry fiction related. So that's Marathi also and English also, but that's one of the area. Another thing, I love traveling. So going different places whenever I get time, and it not necessarily you have to go to abroad all the time. There are close things over here with family. You can spend a good time. So that's another hobby which I have and I enjoy that. Means every month you need a 2 days. That is okay, and once in a year probably a long
yeah.
tour. That helps me to keep myself on the high energy level again.
I think IPA as an organization is doing
Yeah.
really good in terms of creating that collaborative culture within some of the top pharma companies. So, Shirish, do you want to spend maybe just last couple of minutes on what's the mission, what's the goal that I think we are trying to achieve with the IPA initiatives?
I think one of the important thing which, apart from the all policy decisions and other thing where we work with the government, but also the quality forum what we run, and that is a big thing which we are getting it from this. 6 companies, we get the top people over there, and they are able to share their own documents, which otherwise people will be not be happy to share with anybody. To get onto that particular area, what can be done better, who is doing better, and how can we get into this, and coming out the best practices documents every year. Every year we have got 4 subgroups minimum, and they share their paper, they share their SOPs, they share their what has gone wrong, what is the investigations, all those things. And that is probably, see, we may fight in the marketplace, Cipla versus Zydus or Zydus, that is in local or even in US market, it's normal. But it's a great thing that on technical things we are coming together and able to share the best practices across. Similarly, FD 483s, generally people would not like to share, though it is available onto the site and other thing. People would not like to discuss why those points came up. Now, with the recent phenomenon we have started, that these companies share with all our member companies, 25 companies, under what circumstances that FD483 is given, and what you can do to avoid that in the future. So, which is, I think, is a good. In addition, we also do the every year. We have got one is the, we call it the Global Quality Summit, GPQS, Global Pharma Quality Summit, which is we get the top people from the FDA, top people from the industry, top people from the academy, and we have got their sharing of the knowledge and what needs to in the current topics. This is every year once, and there are also advanced GMP workshops which we carry out. And for that, you don't have to be member of IPA. Any company can join in that advanced GMP. And we used to do at 3 places: Ahmedabad, Hyderabad and Goa, which are the main centers. So there were also requests from the some people to do it in the Bandi, which we may do later. That's what we are planning. But that's another advantage. People share it very openly. Also get the what went wrong. Also, is people are able to tell us. So these activities, and it is very
Yeah,
good to meet those people and exchange those ideas. That's what through IPA, and the goal of the
yeah,
IPA is, I will tell
that
you,
there's
India has gone through
yeah,
the very bad phenomena. For 5 6 years, there was a continuously issues related to this. So we want to bring up the overall entire manufacturing and not just 25 companies, so that we go to the next level of quality. We are also trying to do with government that they should get into the, now they are saying about the ICH bodies as well as the PIC convention, so that our standard of the entire industry will go up. One is doing this thing from them, and also through the regulators to ensure that it is happening. So if you see really last 1 2 months, CDSU with the new chief over there has started a new agenda of ensuring that those who are not good, they should be shut. So he has almost done some 170 plants not shut down through this. So he's putting in the pressure so that whole industry goes up. Both hand holding as well as the stick, both approaches are required to do this.
so Shirish, it has been a true pleasure having you on this podcast today. Would love to bring you back. I know we have to discuss a lot more, but thank you so much for being generous with your time as well as the insights that you have shared with the viewers today. Thank you.
Thank you very much, Vivek. This was a good opportunity to interact with you because Rajiv talked to me about your company and what you are doing. They are implemented in, I
Yeah,
think, in Lipin to some extent, right?
yeah, yeah,
Good. Thank you very much once again. Thank you.
yeah. Thank you.
Bye. Bye.